Okay, we have a patient arriving soon for the Classic Cranial Nerve Exam. Okay, let's have the front desk send them on in. Okay, and I think I have all of my items here ready to go. Oh my goodness. Hello there, and welcome to the clinical office. Are you my patient today? Great. You're here for the Classic Cranial Nerve Examination. Is that you? Great. Pleasure to see you today. I'm Dr. Brain. I will be your physician taking care of you. Are you okay with me being your doctor today? Great. Sit down right at that medical chair that's right in front of me though and get cozy. If it's cold, we have blankets and pillows, but I'll bother the nurses if you ever need that, okay? Good. Sit down, get cozy. So it looks like on my report here that you're here because you have given yourself a little bit of a boo-boo right on your forehead. What happened? I can tell, yes, you fell asleep watching TV and woke up on the floor. No memory of that. Got it. So your sleep schedule's a little wild. Okay, quick question. Can you see my hand right there next to your eye? And what about there? Okay, can you look straight at me? Just some preliminary tests. Look at me. Okay, look there. Look back at me. Okay, good. No nystagmus currently, but we'll test for that. Ever had a cranial nerve exam before? I'll give you the rundown even if you have. We're going to be testing all 12 of your cranial nerves. There's a ton of them, a lot of tests, but it's very relaxing and a lot of people fall asleep. Okay? And I'll show you, very simply put, we're just going to be doing different types of tests with your eyes, nose, mouth, and movement. Got it? Good. Any questions, you can ask me. And first we're going to test your vitals. Did I never see you before? Good. Did they get your heartbeat? Okay. And how was your day? You just look super tired, like you have very large under eye bags. We call this luxury. Chanel, Louis Vuitton. So, got the gloves on now, and we're going to start by just getting a couple of your vitals. Can I touch your face, especially on your forehead? Okay. And do you have a headache right now at all? Okay. If that changes, let me know. I'm just going to put some pressure here. Is that okay? Can you feel that? Good. What about that? Okay. Can you feel when I touch on your nose? Focus on me. Good. Are you feeling a little sleepy? Let me just turn the lights down a little bit. Okay, look at me. Okay, can you feel when I put pressure right underneath your eyes? Good. Okay, any pain? Okay, I'm gonna feel right here on your lymph nodes. Have you been sick within the past 2 weeks? Okay, any flu-like symptoms or allergies? Okay, any sensitivity when I put pressure here? Okay, can I feel your shoulders? Okay, any pain or sensitivity? Okay, then let's look right back at that forehead. Okay, I'm going to quickly get your temperature. I'm going to put it in each ear. Hold still for 5 seconds. 5, 4, 3, 2, 1. You'll hear a click. Good. 98.6 on this side. Hold still. 5, 4, 3, 2, 1. You'll hear a click. 98.6. Temperature seems to be good. Okay, I'm going to put that information down. Today's clinic is proudly sponsored, so while I have this information to put it in, there's going to be a slight pause. I'll be back right after. I'll see you soon. Let me show you something I've been trying during my little phone breaks. This is Free Cash. When I'm winding down, waiting for an appointment, or relaxing, I'll open Free Cash. You can earn rewards by playing games, completing surveys, and finishing offers. Just sign up, enable app tracking, and start earning. I'm currently working on this game offer, and so far I've earned $11. If you make in-game purchases, you can make progress faster. Once you reach $25, you can withdraw through PayPal, gift cards, and other options, and cashing out is simple. I'm choosing Amazon. Just select your reward and confirm. The app layout may vary by country, but the process stays the same. So, what are you waiting for? Join me and use my link in the description or scan the QR code to try Free Cash. You'll get a $10 bonus after completing your first offer in eligible countries. Thanks to Free Cash for sponsoring today's video. Information inputted. Welcome back from the break. Okay, now just a quick vitals check from you. May I just get your pulse right there? And we're just going to listen to the sound of the heartbeat right here. Let's listen. Good. Breathe in. Breathe out. Breathe in. Breathe out. Good. Relax. Okay. We're looking at a 98 resting pulse. And we're going to start by testing your eyes, if that's okay with you. And then we're going to test your nose. Okay? How is the sensitivity of the light towards your eyes? I can drop it by a little bit more to get you a bit more comfortable. Is that better? Good. I have a pen light here, and we're just going to first take a look in your eyes, and what we're going to be testing is the optic nerve, and we're going to be testing your ocular motor function. Okay, can you see me right here? Good. Can you look right at that light? Good. Look back at me. Good. And look at that light. Is it really bright, or is it not too bright? Because we just want to get the correct vision for you, okay? Look at the light. Look back at me. Too bright? Okay. Other eye. Can you look at me? Look at the light. Look back at me. Can you look at the light? You have beautiful eyes. They're just extremely red. How often do you sleep? Not too frequently. What's been your sleep schedule like? Really late nights. You gotta go to sleep. Okay, look at the light. Okay, look at me. Is that too bright? Okay, I'm gonna turn the lights off now here. You'll still be able to see me, but we're gonna do a little bit of a lights off test. Okay, accommodating the room to your eyes. Where is the light the brightest? Focus. There. Is that the brightest there? Okay, and what about there? Okay. Let's pull one more of the pens. We have one pen that's brighter and one that's more dull. Which one's more bright? The white one or the gold one? Take a look. Which one's more bright? The white one? Good. What about now? The white one or the gold one? The white one, excuse me. What about now? Which one's more bright? The white or the gold? The gold? Okay. What about now? Which one's more bright? The white or the gold? The white? Okay. I'm going to move it a little bit closer to you, okay? If it's too bright, you can close your eyes. Which one's more bright? The white or the gold? The gold one. Okay, and what about now? The white or the gold? The white one. Okay, let me know which one turns off first. White or gold? White. Which one turns off first? White or gold? White. And one more time, which one turns off first? White or gold? Okay, and one more time, which one of the lights turns off first? White or gold? Good. Great. Okay. we're going to do now with this pen light is I'm going to have you do something called follow the light. We have a brighter light. Okay, I'm going to close your eye. Can you look right at that light right there? It's going to be really bright. Can you see that? Okay, let me know when you can no longer see it with that eye. There. Good. Bright light. Let me know when you can no longer see it. There. Good job. Bright light. Let me know when you can no longer see it. Good. And bright light. Let me know when you can no longer see it. Good job. Okay. Other eye. I think this eye might be a bit more sensitive to the light, correct? Let's test. Let me know when you can see the light. There. Let me know when it disappears. Good. Bright light. Let me know when it disappears. Good. Bright light. Good. And let me know when it disappears. Good. So this eye is a bit more sensitive. Okay, looking at both eyes. Follow the light with both of your eyes. I'm going to carefully look for something called nystagmus. That's when your pupils are constantly moving. Follow the light. Good. Follow the light. Good. Follow the light. Good. Follow the light. Good. Look up. And down. The center. And up. And down. Good. Okay. I think we've seen enough light. I'm going to test your eyes now in a different way. I'm going to give you a peripheral vision test. Let me know when my hands are no longer in your peripheral vision. Let's start. When do you no longer see my hands in your peripheral vision? Say when. Let's start. There. Good. There. There. Good. Look at the center. There. Good. There. And one more time. There. Good. Okay. Now let me know the opposite. Let me know when you can see my hands in your peripheral vision. Just say when. Keep focus. There. 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 Good. There. 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 Okay, good. And last test with your eyes. I'm going to give you a color blindness assessment. Just let me know which colors you can or can't see. I'm going to turn the lights up just a little bit for this. So just take a guess what color I put in front of your eyes with these little color panels. Are you ready? Let's begin. What color is this? Take a look. 5, 4, 3, 2, 1. That's like a light pink or a purple. Which is it more close to? Pink. Good job. Okay. What color is this? 5, 4, 3, 2, 1. Is it blue or green? It's a bit more green. Good. Okay. What color is this? 5, 4, 3, 2, 1. Is it purple or pink? good. What color is this? 5, 4, 3, 2, 1. Green or blue? Blue? Okay, and what color is my t-shirt now? Blue, very good. Good. What color is this? Here we go. 5, 4, 3, 2, 1. Purple or green? It's purple. Good. Okay, what color is this? 5, 4, 3, 2, 1. This one is like a yellow or a lime. Which is it more close to for you? This one's different for everybody. A bit more green. Okay. What color is this? 5, 4, 3, 2, 1. This one's like a light orange or a yellow. Which one is it more closest to you? Again, a difficult one. Maybe like a yellowy orange. Okay. And here's the last one. What color is this one? Take a guess. 5, 4, 3, 2, 1. This one is red. I'm going to give you a quick red light test. Can you see the light? Okay, we take it away. Can you see the light back here? Okay. Might be bright, but what color is that light all the way back here? Is it red or is it more white? Kind of red. What about a little closer? Is it red or white? It's more white, a little less red. Okay, and what color is that all the way back here? That is red and white. Good. And what color is my t-shirt? It's red. What color are my gloves? They're like a purple now. What color is the wall behind me? Red. Okay, good. This is a red saturation test. And it looks like you passed. Good job. We're going to test your nose now, which is the olfactory sensory nerve test, and then give you a taste test. I'm going to ask you to close your eyes and do not take a look because it'll be obvious what you're smelling. But I want you to take a guess what you could potentially be smelling. These are basic essential oils. Let's start off with this first one. Eyes closed, please. Do not look, otherwise it will ruin the test. So eyes closed, we're testing to see if your senses work. Eyes closed, and breathe in. What is this essential oil? Breathe in. Breathe out. Take a guess. Like a bakery? Like a cupcake? Like cake and pastries? Any guesses? 3, 2, 1. Good. Baked goods would have been correct. This one is vanilla. This one smells exactly like vanilla. It is amazing. It reminds me of, honestly, like cake. It's delicious. Good job so far. It might get a bit more difficult as we go along, but you're doing great. Okay. What is this one? Eyes closed. Okay. Eyes closed. Breathe in. And out. What is this essential oil? Breathe in. And out. This one is almost immediate. Citrus, fruit, lemonade. Any guesses? 5, 4, 3, 2, 1. Lemon or lime, correct. That one smells fantastic. It literally smells like lemonade. Good job. Okay, what is this next one? This one might be obvious as well. It's my favorite. Okay, close your eyes. Breathe in. And out. What is that? Refreshing, minty. Any guesses? 3, 2, 1. Cooling. Good. This one is mint or peppermint. This one's very strong. It smells like winter time. Good job so far. Here's where it's going to get a little bit more difficult. Okay. This one is tricky. What is this one? Eyes closed. You're going to want to open your eyes. Oh, that smells amazing. Okay. Breathe in. And out. This one's floral, yes. Like a bouquet. Good. Like the outdoors, amazing guess. And very floral. Any idea? 5, 4, 3, 2, 1. Okay. This one was a bit difficult. It is floral, but this one is rose. Most people are unable to identify that one specifically, but you were great. This one's very floral forward. It reminds me of perfume. Okay. This one is one of the more difficult ones, and then we've got one left. Oh, I love this one though. Close your eyes. Breathe in. And breathe out. What does that remind you of? Breathe in. And out. Breathe in. And out. What is that? Outdoors, like nature, but a little lemony. Okay, any guesses? 3, 2, 1. Good. This one was very hard. Barely anybody gets this. This one is lemongrass. It smells like an herbal medicine. I quite like it. And here's the last one. You can keep your eyes open, but you won't be able to tell what it is because I'll have to read it for you. So take a guess. What is this one? Breathe in. And out. What is the main essential oil that you smell on this one? Breathe in and out. So this one is very lovely. It reminds me of a bakery, and it reminds me of something in particular that you would drink in the morning to make you energized. What is this one? 3, 2, 1. Good. The trick to this one is that this one is coffee. It's called sleep because it helps you sleep as the smell is good. Good job. Okay, take a break. We're going to give you a taste test now. And I have a bottle here. And what you're either going to get is sour or sweet. Of course, I know which one this one is, but you take a guess and say, ah. Okay, 5 drops. Say, ah, sour or sweet. And do this. And what is that? Very good. That one is sour. It's actually lemon. Good job. Okay, you can take a break now with the essential oils. We're going to give you your last tests here, which will be your basic tests for musculature and cognitive functioning. Okay. Just sit still. I'm going to drop the lights a little bit to help you. We're first going to test to see if you have vertigo. I want you to look at the circle. I'm going to move it and let me know, does the circle stay still or does it move? Okay, look at me. Do you see the liquid flowing between the glasses? Sit still. Keep focus. I'm going to move it away, farther away so you can see. Okay, can you see my eye? Keep focus at my eye. Good, look at my nose. nose. Keep focus at my nose. Good. Okay, look at my two eyes. Keep focus on my eyes. Good. Okay, vertical movement here. Keep focus. Okay. And then focus here. 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 There. Here. And there. Good movement. And focus on the flow. Good. Now, let's put the glasses down. Look at me. Okay, it looks like your eyes are not moving in any way, shape, or form. That would look like nystagmus, so it looks like we're good. Are you feeling dizzy at all? Nope. Good. Okay, I'm going to put my hands right there on the back of your head. I'm just going to tilt and turn you a little bit. Okay, how many fingers am I holding up? 2. What about now? 3. Now. 1. 4. 1. 2. Okay, look at my finger. No signs of nystagmus. Good. Tilting you the other direction. You can look at my book set. Okay, how many fingers am I holding up to? 1, 2, 3, 4, 2, 1, 5. Good. Follow my finger. Good. Okay. Let me look for any signs of nystagmus. Nope, your eyes are good. Back at the center. How many fingers? And now, 2, 2, 1, 3, 2, 4, 2, 1, 1. Good job. Okay, that was good. Let's test your facial tonage. Raise your eyebrows really tall and hold them like that as if you were shocked. And hold for 5, 4, 3, 2, 1. Relax. Furrow your brows as if you were angry. Angry. 5, 4, 3, 2, 1. Good. Relax. Close your eyes. I'm going to try to open them and I want you to resist. Eyes closed. Resist. Resist. Okay, and resist. Open. Good. Close one eye. Open it. Close the other eye. Open it. Good. Okay, give me a smile. Relax. Give me a frown. Relax. And I want you to swallow. Good. Raise your shoulders and resist me pressing down on them. Good. One more time. Okay. Shake my hand. Shake my hand. Good. That's pretty good. Okay, can you say ah? One more time. Say ah. Okay, say oh. Say oh. Okay, good. And repeat these words after me. Good night. Good. And one more word. Sweet dreams. Good job. Okay, it looks like you passed your cranial nerve exam today. I will resend your results in the morning, but this is a sleep study, so you will be here just until morning and are going to repeat the tests. You do not have any issues at all whatsoever. The classic cranial nerve exam just tests to see if you've had any vestibular issues caused by that little ouchie right there on your forehead, okay? Good. So I'll send the nurse in and we will give you the pajamas for the evening. I want you just to relax and we're going to repeat this by morning time. If not, you can repeat the video just until then. But we're going to reanalyze our results for your results with another doctor to make sure that we got everything and that I didn't miss anything, okay? Thanks for coming on by. My name was Dr. Brain and it was amazing to see you today here at the Dream City Clinic.